Today I shall be talking about bone neoplasia. Talking about classification, which is given by Ine King. The tumor is classified into benign and the malignant. In benign there is latent, active and aggressive stage. In latent there is no activity, there is no symptoms, no pathological fracture, there will be no growth and no treatment is required. An example, the tumor which is latent is non-ossifying fibroma. In active tumor, activity is less than 5 cm. This is with or without symptoms. There is risk of pathological fracture. It is spread locally and the treatment is excision and can extend up to extended curettage. And the example is simple bone cyst and the aneurysmal bone cyst. In aggressive tumor, the activity is more than 5 cm and it is symptomatic and the pathological fracture occurs and there is potential of malignant transformation. And for the treatment, extended curettage, removal of the tumor and the surrounding tissue, and ablation of the margin with or without grafting can be done. And the example is giant cell tumor and the which is also called osteoclastoma. On malignant classification, it is based on stage, histological grade, location and metastasis. Stage 1A, 1B, 2A, 2B and 3. And grading 1A and 1B is falls on low grade and 2A and 2B on high grade and 3 it can be low grade or high grade. Talking about location, 1A is intracompartmental and 1B is extracompartmental. 2A is intracompartmental and 2B is extracompartmental and 3 can be intracompartmental or extracompartmental. In metastasis, 1A, 1B, 2A, 2B do not metastasize but stage 3 metastasizes. Talking about location of the tumor, it can be epiphyseal, metaphyseal and diphyseal. In epiphyseal, there is chondroblastoma, which more commonly occurs in the proximal humerus, and giant cell tumor, which occurs in the distal femur, proximal tibia and distal radius. We can also remember as mnemonics, as there is mnemonics ECG, epiphyseal, E epiphyseal and C chondroblastoma and G giant cell tumor. In metaphyseal, there is osteosarcoma, which is most commonly in the distal femur, proximal tibia and proximal humerus. Chondrosarcoma, which is most common in iliac bone of the pelvis. Osteochondroma, most common in the distal femur and the proximal tibia. Osteoblastoma, most common in the thoracic vertebra. And simple bone cyst, most commonly in the proximal humerus. Aneurysmal bone cyst in the distal femur and proximal tibia. In chondroma, small bones in the hands. In diphyseal tumor, there is Ewing sarcoma, multiple myeloma, which commonly occurs in the lumbar vertebra. As there is many L, we can also remember like that. In osteoid osteoma, adamantinoma, fibrous dysplasia, which occurs in the femur and the craniofacial bone. There is mnemonics. If you feel it easy, you can remember like this. Elsa D. Bout foam, FOAM. E. DI, diaphyseal and E. Ewing sarcoma. F. Fibrous dysplasia. O. Osteoid osteoma and A. Adamantinoma and M. Multiple myeloma. About age predilection, in 0 to 10 years of the child, Ewing sarcoma, simple bone cyst and polyostotic fibrous dysplasia is common. It is before physeal closure. 10 to 20 years of the child, osteosarcoma, osteochondroma, chondroblastoma, osteochondroma and monoostotic fibrous dysplasia. In 20 to 40 years, giant cell tumor is common. In 40 to 60 years, chondrosarcoma, secondary osteosarcoma and metastatic lesion. And above 60 years, multiple myeloma. This is all about introduction to bone tumor. Thank you.